So I'm going to turn to consider questions of the communication of risk by Armour, largely in terms of product labelling, data sheets and the like. But before we look at any specific documents, I just set out an observation which has been made to me by a representative of core participants, not specific, I should say, to Armour, but on the question of warning labels and data sheets and so on more generally. And that's to just point out there may be a question mark as to the extent to which those are written materials that would have been seen by patients, or at least seen by certain cohorts of patients, leaving aside the question of whether what's in a product label or product insert can ever be a substitution for the clinician's discussion of risk. There will be some cohorts of patients who may never have seen that in any event, children, those treated in hospital, not at home, and the like. And so that was just an observation made to me on behalf of a number of core participants that I said I would draw to your attention.
If I may just comment for one moment, one of the documents you showed me this morning described it telling others and users, it said, of certain features about the product. By users, it was quite clear from the context it meant doctors.
Yes, absolutely. So with that general observation in mind, we'll then turn to some of the specific materials relating to the Armour Factor 8 product. If we start with Armo 602, this is from the 1975 application for the product license for Factor 8, much of which we looked at yesterday. But if we go to page 60, please, we can see some of the materials, the warning and other materials that accompanied the application, or at least form part of the file containing the application. And we can see their caution, so these are the last 3 lines, this product is prepared from pooled human plasma. Despite careful selection of donors, it may contain causative agents of viral hepatitis. And then within the same document, if we go to page 66, this is described as a revised package insert leaflet, and again, it appears in as part of a file which suggests it was being put forward as part of the application. And we can see there the heading warning on the right-hand side, anti-haemophilic factor human. Factor 8 is prepared from human plasma, each donation of which has been found negative for hepatitis B surface antigen by the RAA method. In addition, this lot, after reconstitution as directed in this insert, has been tested and found negative by the RAA method. However, since no completely reliable laboratory test is yet available to detect all potentially infectious plasma donations, the risk of transmitting viral hepatitis is still present. So that was material at the time of the license application for Factor 8. If we go on to Armo 606, this is a letter 17th of May 1976 from Armour to the DHSS Medicines Division, and we can see it refers to the data sheet. This is in the last paragraph of the letter. The data sheet for Factor 8 are now in draft form. I enclose a copy for your attention. And then if we go to page 3, top of the right-hand side, we'll see year after year the terminology and language use is almost always the same. So we see here the warning, Factor 8 is prepared from human plasma. There's reference then to the testing of donations for hepatitis B surface antigen. There's reference to testing the batch by the RAA method as well. And then the same general statement, the risk of transmitting viral hepatitis is still present. If we move to 1977, ARMI 5017, the date is in the bottom left-hand corner, October 1977, and the product licence holder is identified as Armour Pharmaceutical Company Limited, Eastbourne. We can see it's a data sheet for Factoration. If we turn to the second page, top right-hand corner, we've got the warning. Again, the language used has not changed from the draft submitted in 1976. If we then go to 1978 and the high potency factor rate, it's an ARMO 5023. And if we turn to page 10, we can see here, and this is part of the draft package insert, warning. Again, essentially the same points being made, testing of the donations for hepatitis B surface antigen, testing of the batch, but no completely reliable laboratory tests, so the risk of transmitting viral hepatitis is still present. If we go on to page 12, in terms of packaging, bottom of the page, there's the heading caution. The product is prepared from pooled human plasma despite careful selection of donors and non-reactivity of the reconstituted solution for hepatitis B antigen by the radioimmunoassay procedure. Freedom from causal agents of viral hepatitis cannot be assumed. So put in a slightly different way there, and the reference to selection of donors, but the same essential method, it might be thought. If we go next to ARMO 5035, I'm not going to go to the details of it, so I'll ask you to note we're now June 1979, and we have a draft package insert, a further version being sent, but it has the same terminology on, and you'll see that. I don't think we need to go to it from pages 5 and 7. Exactly the same language used as that was enclosed with the original product licence application for high potency factor 8. That brings us then to the therefore to 1979. If I then just pick matters up by reference to the ABPI compendium of data sheets for 1980 to 81, if we go to ABPI 5040, and I hope I've got the right page references here because I've only got the individual sheets. Page 5, I'm hoping will be the right one. Yes, so the point here, if we look at the bottom right-hand column, factor 8, as in the Armour product, factor 8, the trademark product, is not listed in the index. If we go to page 14, no, if we go to ABPI 5039, sorry, Shomik. And go to page 14. Other Armour products are included in the 1980-81 ABPI compendium, but not factor 8. If we then move on to 1981, ARMO 5091, and if we go to the bottom of page 2, we'll see the date. This is described, sorry, show me top of the page first of all, my apologies. This is described as an application for a product authorisation for Factor 8 double fill presentation. Some form of variation, essentially. September 1981 is the date at the bottom of the page. If we go to page 5, we will see under the heading Warnings, paragraph 12. Again, this is the draft package insert submitted with the application. As at September of 1981, it's essentially the same terminology as was used consistently really from the late 70s onwards. Factor 8 is prepared from human plasma, each donation of which has been found negative for hepatitis B surface antigen by RIA method. In addition, each batch, etc., has been tested. Since no completely reliable laboratory test is yet available to detect all potentially infectious plasma donations, the risk of transmitting viral hepatitis is still present. So the language is, as we'll see from that, unchanged. And if we go to page 8, and if we could zoom into the top part of the page, we've got the warning there. We just top left-hand corner. It's essentially the same language on that label. I don't think I need to show you the 1981-1982 ABPI compendium of data sheets. I'll give you the reference. It's ABPI 5042. Again, although Armour participated in the sense that there are other Armour products listed in the compendium, Factor 8 still doesn't feature in the ABPI compendium of data sheets. If we go, however, to the 1983-4 compendium, which is ABPI 5045, and we go first of all to page 2, we can see the heading New Products and the italicised sentence at the top. The following names appear in the index to this issue of the compendium but did not appear in the 1981-82 edition. It does not necessarily follow that they're recently introduced products, and of course Factor 8 wasn't. And then if we go down towards the bottom of the page, left-hand side, the index for F, we can see that Factor 8 is there listed. And then if we go to ABPI 5046, page, try page 14, would you show me? Yes. So if we just zoom in, there, we've got there Factor 8 there set out. If we go to the next page, halfway down the page, we've got contraindications, warnings, etc. Warning, Factor 8 is prepared from human plasma, each donation of which has been found negative for hepatitis B surface antigen. In addition, each batch after reconstitution is recommended has been tested and found negative by the RIA method. And then the same terminology, the risk of transmitting viral hepatitis is still present. This compendium was, I think, published in January of 1983. I can double check that. I mention that because you'll see, of course, that there's no reference there to HIV, HTLV3 or AIDS. If we go to the right-hand column, we see there high potency Factor 8 is also listed in the compendium. And if we turn over the page, we'll see at the very bottom of the left-hand column, under the heading contraindications, warnings, etc., the same terminology is used. So it's the same language for high potency Factor 8 and Factor 8. I don't think I need to read it out. Sticking with the ABPI, if we go to ABPI 5050, and this is the ABPI datasheet compendium for 1984 to 5. If we try page 3, Shomik. Yes, so if we look at the heading Data Preparation, halfway down on the right-hand side, it says the data sheets included in this compendium were prepared or reviewed during the final quarter of 1983, and the compendium itself was published in April 1984. And then if we go to page 14, we see the entry, bottom right-hand column for Factor 8, and then the warnings are on the following page, top half of the page, right-hand column. So the contraindication warning there, again, is in relation to the testing for hepatitis B surface antigen and the fact that the risk of transmitting viral hepatitis is still present. There isn't, as far as I'm aware, in this, any reference to AIDS. And the same is true, I think, in relation to the high potency Factor 8, which starts at the bottom of the page. If we go over to what should, I think, be page 16, the contraindications warnings halfway down the right-hand column are in identical form to that for Factor 8 itself. If then we leave the ABPI and go back to the license application documentation, ARMO 40145, so we'll see this is the application submitted in May 1984. It's essentially for renewal of the product license for high potency Factor 8. And if we turn to page 11, we can see warnings and adverse effects. Again, largely the same language, a slight modification. So it reads, Factor 8 is prepared from human plasma, each donation of which has been found negative for hepatitis B surface antigen by the RIA method. In addition, each batch, etc., has been tested and found negative. However, since no completely reliable laboratory test is yet available to detect all potentially infectious plasma donations, the risk of transmitting viral hepatitis to patients is still present, and personnel administering and handling this material should also exercise appropriate caution. So that's that slight refinement, and I think that's the only reference in this document. So that's as at May 1984. If we then turn to 1985, ARMO 40165, this is a letter dated the 13th of February 1985 from Armour to the Medicines Division at the Department of Health, and it refers to enclosing label texts for the above products, which are Factor 8 and high potency Factor 8. If we go over the page, so page 2, we can see that, so it's an important leaflet, see leaflet for complete information, and then there's the caution. This solution is of human origin. Despite careful selection of donors and processing, it cannot be assumed to be free of hepatitis virus. And then bottom of the page, the caution in the left-hand side, thank you. The product is prepared from pooled human plasma, despite careful selection of donors and non-reactivity of the reconstituted solution for hepatitis B antigen by the radioimmunoassay procedure. Freedom from causal agents of viral hepatitis cannot be assumed. And then if we go to the next page, just turn it round. I think we've got the same language there, and then the bottom of the page, left-hand corner, yes. So the same terminology used. So no reference, sorry, if we just go over the page. I'm not quite sure, so whether these are just multiple copies of the same labels or there's a difference between the labels. Maybe there's a difference in terms of sizes, I'm not sure. But again, we've got similar caution, the solution is of human origin. Despite careful selection of donors and processing, it cannot be assumed to be free of hepatitis virus. So the terminology there is all relating to the hepatitis virus. So you'll see no reference there to HIV or to HTLV3 or AIDS. If we go to page 5, we can see the proposed data sheet test for high-potency factor VIII here set out. And if we turn on to page 7, under the heading Contraindications Warnings, the warning is in the same terminology as we've seen really from the late 1970s onward, with the risk of transmitting viral hepatitis being identified as still present. So that's as at February 1985, when this material is being sent to the Department of Health and Social Security Medicines Division. No reference there you'll see to HIV or AIDS. There is actually a documented ARMO 40366, which shows that the department did pick up upon an issue relating to the content of the data sheet and package insert, but it's not, in terms of the language of the warning, what's said is the DHSS have insisted that we, as for all other manufacturers / suppliers of such products, include the temperature and time of the heat treatment in the data sheet and package insert. And additionally, we've had some minor altercation, I think there should be altercation, with them over the names of the products, in that they require the words heat treated in the product name, whereas we wanted these words prominently on the label but with the product name intact. So the Medicines Division pick up on aspects of the content of the sheets and the labels, but not in terms of the warning. If we then turn to the next ABPI compendium for 1985 to 1986, should be at ABPI 5022. And we turn to page 15. Bottom right-hand corner, we have the entry for factor VIII. If we turn over the page, halfway down the page on the right-hand side, again under the heading Contraindications Warnings, it says factor VIII is prepared from human plasma, and it's the same terminology, the same language used in relation to testing for hepatitis B surface antigen and the risk of transmitting viral hepatitis still being present. So no reference there to, again, to HTLV3 or AIDS. And the same is true for the high potency factor VIII. Yes, I should say that compendium was published in July 1985. The introduction to it explains that it's prepared, or the data sheets have been prepared or reviewed during the last quarter of 1984, just to give an idea.
Just go back to it for a moment. The side effects, bottom right-hand side.
Products of this type are known to cause mild chills, nausea, or stinging at the infusion site.
Yes.
Yes. Yes, I should have said a lot of the labels over the years contain a similar description of side effects, but yes, it's mild side effects there being described, and nothing associated with HTLV3 or AIDS. If we then pick it up with a further application to vary the product licence at ARMO 40181, this is the 9th of January 1986, an application by Armour to the DHSS, enclosing applications to vary the above product licence. We looked at this earlier. If we go to page 3, we see what the proposed variation was. On the right-hand side under the heading proposed, it was the inclusion of the fact that units of source plasma were tested for HTLV3, and it says proposed datasheet text attached. If we go on to page 5, we can see what I think is the proposed datasheet as at January 1986. So under the heading presentation, and we looked at this previously, there is reference there to HTLV3. It's the 4th paragraph under presentation, in the context of there having been tested and the units of source plasma having been found to be negative. If we turn to page 7, the contraindications, warnings, etc., at the bottom of the page, the language is unaltered, so it still refers to hepatitis B surface antigen testing in terms of both the plasma and the batches of reconstituted product. It refers to the risk of transmitting viral hepatitis, and then has the same terminology in relation to side effects that you pointed out, sir, products of this type known to cause mild chills, nausea, or stinging at the infusion site. So no inclusion as a warning or side effect of the possible transmission of HTLV3. And then we can see, if we go to ARMO 40531, this is May 1986. So we can see active consideration being given to the content of the datasheet and leaflet. It says the Factor VIII datasheet's recently been amended to include details of heat treatment and testing for antibodies to HTLV3 virus, which essentially is what we saw under the heading presentation in the earlier document. Therefore, please arrange to update the leaflet to include the following statements at the end of the section on composition and standardization. This product has been heated at 60 degrees centigrade for 30 hours. This step has been introduced in order to reduce the risk of transmission of infectious agents. All units of source plasma are tested for antibodies to HTLV3 and found to be negative. So again, it's in terms of where it appears in the data sheet and in the leaflet, it's not in any heading on warnings or side effects, but that reference is there set out. And then I think we can see that if we go to ARMO 40192, this is the 9th of June, Armour submitting copies of applications for variations to the product licenses for the heat-treated Factor VIII and heat-treated high-potency Factor VIII. If we go to the second page, if we look bottom half of the page, typed in as a cross in the box, other additional information on data sheets. So the variation to the product licenses because they're going to include additional information on the data sheet. And then if we go to the right-hand side, if we go to the next page, we can see the proposed change, which is as at present, but additionally the following information to be included, and we're now in relation to ALT testing. In addition, all units are tested for ALT and found to be less than twice the established upper normal value for the test kit. And then if we go over the page, we see no, in fact, those are the present changes, not proposed changes. If we go to page 8, we'll see what's said to be a proposed change. But I think that's the same terminology we've already seen. So again, it's explaining that the units of source plasma have been tested for HTLV3 rather than anything additional by way of text. Yes, and if we go to page 14, under the heading Contraindications and Warnings, the language in relation to both the warning and the side effects is as set out in the previous documents that we have looked at.
Do we know why the language is all units as opposed to all donations? It depends what units is what units covers.
I'm sorry, so where?
This is all units are tested for whatever it is, ALT in one case.
Oh, sorry, yes.
So it's referring to units, which I've taken to be
Page 3.
individual donations, but I may be wrong. Because it could be a larger unit.
I'm afraid I don't know the answer to that, sir. We can look at it further and see whether we can work out whether there's a significance to be attached to that wording or not.
It's yet another different word.
It is.
Donations, donors, units. They may all mean the same thing, pretty much. But they might not.
No. If we then just have a look at ARMO 40534. This is a letter or memo 10th of June 1986 from Mr. Bishop to somebody else within the company. It says, further to our previous correspondence, I enclose a copy of Cutter's packaging, one of our competitors, from which you can see they're now adopting the suggested labelling. Please advise whether there's any progress with regard to our own labelling. And then if we go over the... Oh, sorry, let me just read the whole of that. If we go back to the letter, my apologies, Shimmick. If necessary and to save time, I suggest a label be produced just for the outers containing the 10 vials, although ideally each individual vial should be so labelled. And the Cutter leaflet to which reference is made is on the next page. Sorry, it's not the leaflet, it's the packaging. And we can see the bottom, if we look at the left-hand side, warning, CoA8 HT is a purified dried fraction of pooled plasma obtained from many donors. The presence of hepatitis viruses should be assumed, and the hazard of administering CoA8 HT should be weighed against the medical consequence of withholding it, particularly in persons with few previous transfusions of blood or blood products. Now, we'll look tomorrow in more detail at the various CoA8 labels and data sheets used from time to time. But you'll see there's a difference there between the way in which that's described and the Armour labels. I think it's however, the strip of white and the language there that Mr. Bishop was probably referring to, although again, no doubt he'll be able to clarify that for us, where it says each individual unit of plasma has been tested for antibody to HTLV3 by an FDA-approved method and found non-reactive. Now, of course, that's still not a warning, but it's a piece of information that it would seem Cutter was placing on CoA8 HT.
Well, it's almost the opposite to a warning, isn't it?
Reassurance,
yes.
Could be said to be.
It's basically saying we're aware of this risk, but we've excluded it by testing. Or not, at least it might be read that way.
Yes. And then if we go to ARMO 40556, we've got a memo from the 14th of July 1986 to Mr. Bishop from AS Clark about Factor 8 labelling. We now have approval from the Department of Health and Social Security for the use of a label relating to HTLV3 antibody testing on Factor 8 outers. So this would appear to be the response to Mr. Bishop's communication. The wording is as per that on the data sheet. We still await approval from the National Drugs Advisory Board. And if we go over...
you may not be able to answer this, I suspect you might not, but the factor 8 outers, there's an earlier reference to vials, individual vials being labelled, so the issue might be whether the outer is the label on the vial, which sounds less likely than it is on the packet. Rather, if one goes to an off-license and buys a 12-pack, it may come in, if you do, it may come in cardboard with labelling on it.
Yes, I'd certainly read it that way. If we go back to the way in which Mr. Bishop expressed his communication at ARMO 40534, he draws a distinction between the outers containing the 10 vials and then as compared to each individual vial. So, yes, I'd read that as effectively the pharmaceutical equivalent of the 12-pack. Yeah. And then if we go back to ARMO 40556, it would appear that what's been done, whether for reasons of speed or for some other reason, I don't know, is the label is going to be on the outers, as opposed, one assumes, to the individual vial. And then it says the wording is as per that on the data sheet. The next page of the document is actually a licensing authority response to a request. So it's presumably the Department of Health's approval of what Ms. Clark is describing to Mr. Bishop. And we can see, if we just go back, if we look at on the left-hand side, present, says on the outer containing 10 vials, labelling as per the attached sheet, and then as at present, but additionally a sticker with the following wording: all units of source plasma are tested for antibodies to human T-cell lymphotrophic virus type 3, HTLV3, and found to be negative. This wording has previously been approved for use on the data sheet. And I should just perhaps make that point. It's probably obvious from everything we've looked at. But the various forms of wording that we've looked at on the data sheets and the like are all material that's submitted to the licensing authority. So it's not the pharmaceutical companies such as Armour simply going it alone. They've submitted their wording to the licensing authority, and we've seen from time to time the licensing authority raises issues, but there's no evidence of any issue being raised about the absence of any warning about HTLV3 or AIDS. So that's where we get to as at the middle of 1986. If we go to ARMO 40566, there's a further communication in July 1986 in relation to labels, and it just says, in order to get more definitive information on the rationale for the statement it has been proposed to make on Factor 8 labels, we've obtained a copy of the test procedure used by Plasma Alliance, and then we can see reference there to the ALT testing. Plasma dilations having an ALT titer above 70 units per ml at 30 degrees C are excluded from plasma pools for Factor 8 production. This is consistent with the label text proposed. So this appears to be a label text amendment in relation to adding some form of information about ALT testing. Lastly, the 1986-1987 ABPI datasheet compendium, which is, I hope it's ABPI 5024. So if we go to page 13, bottom right-hand corner, we have here the entry for Factor 8 heat treated. If we go over to the next page, We see in the top left-hand corner, second paragraph down, the reference there to the heat treatment method. This product has been heated at 60 degrees centigrade for 30 hours. This step has been introduced in order to reduce the risk of transmission of infectious agents. So there's an explanation as to why there is heat treatment. There is then reference in the next paragraph to the units of source plasma being tested for antibodies to HTLV3 and found to be negative. If we then go to, on the same page, bottom right-hand corner, we've got there contraindications, warnings, etc., and we have the same terminology in relation to warnings. So it's the same terminology as we've seen over the years. The reference to testing for hepatitis B surface antigen, the possible present risk of transmitting viral hepatitis, and then the side effects of mild chills, nausea, or stinging. But nothing further. And the same is in this compendium. It's the same information, I think, for the high potency heat-treated factor VIII. So those are the documents that we presently have in relation to product labelling, package inserts, data sheets in the period up until 1986. I should just, if I may, read a very short paragraph from the Crever report. I don't have it available to display on screen. It's chapter 14 of the Crever report, which obviously was the Canadian inquiry into blood contamination. And it's page 399 of that report. And it says this: when fractionators prepared their vials of factor concentrate in packages for shipping, they included printed information about the concentrates, their proper use, and possible risks in using them. In the autumn of 1983 and in early 1984, US fractionators added warnings about the risk of AIDS to the information in the product inserts. Armour for its factor VIII concentrate in October 1983, Cutter for its commercial factor VIII concentrate in January 1984, and Highland for its factor VIII concentrate in March 1984. We haven't found, sir, those. There are no specific documents cited in support of that passage in the Crever report. We haven't found any specific documents which show the addition of warnings about the risk of AIDS in the United Kingdom. So it's possible, and that the Crever report leaves open the possibility that there may be material that we haven't found. But what I've shown you, sir, is what was submitted to the licensing authority and what was included in the ABPI compendium.
If he's accurate in what he says, then the warnings that were given in the USA were not given in the UK.
That's an inference, the obvious inference to draw from what's said, combined with the absence of any material that we've seen.
But the parent company involved is exactly the same.
Yes.
And the products are made in the same place.
In Kankakee, Illinois.
Yes.
Yes. So it may be that there is material that we have not found. And it's for that reason that I wanted to draw your attention to what was said in the Crever report, in the interest of trying to be as fair and comprehensive as possible. So that's it in terms of data sheets, package inserts, product labels. I just want to turn to a few other aspects of what might be called communication of risk. The first is to draw your attention to a document which we may come back to at a later stage. It's at BAYP 0005366. This is a letter dated August the 14th, 1984. It's addressed to Cutter, and it describes in the first paragraph a meeting in Los Angeles between Cutter Highlands representatives and the organisational body which is sending this sending this letter, the name of which at the top left-hand corner is not entirely clear. It looks like Hill and Knowlton, not 100% shortened. In any event, we can see if we look in the first paragraph, it says, "We regret we were not able to meet also with people from Alpha and Armour, as we believe the 4 companies, along with perhaps the Red Cross, have a common need for a good, honest, straightforward education programme." And then it goes on to talk about communication of information to patients and to the public. Now, I'm not going to go through the detail of this letter, not least because it was directed to Qatar rather than to Armour. But if we go to page 5, what we see here is the text of what's said to be a public relations proposal by a public relations firm, Burson Marstella, I think, August the 13th, 1984. It's described as a public relations proposal for Highland Therapeutics, Armour Pharmaceuticals, Qatar Biological and Alpha Therapeutics. Now, it may be that this is a document that never got to Armour. And so it may be that there are, absent any further information, that we find that there are no particular conclusions that can be drawn in relation at least to Armour or Alpha, who were not apparently at the meeting in Los Angeles. But if we go to the next page, we see what's said under the heading Situation. 4 companies, Highland Therapeutics, Armour Pharmaceuticals, Qatar Biological and Alpha Therapeutics, comprise an industry that provides an anti-haemophilic factor to approximately 20,000 haemophiliacs nationwide. That's obviously talking about the US. Last year, it is estimated that 40 haemophiliacs contracted and died of AIDS after receiving an infusion of anti-haemophilic factor that was contaminated with the virus. Subsequently, haemophiliacs nationwide have reduced the frequency of their infusions because of the fear of contracting AIDS, even though their physicians and the haemophiliac associations have urged them to maintain normal infusion rates. Consequently, sales for the anti-haemophilic factor have declined 15 to 20% in the last year. Alpha, Qatar, Armour and Highland have asked Burson Martellet to develop a public relations proposal to address the problem of decreasing infusion rates of the anti-haemophilic factor among haemophiliacs. Now, that refers to this firm being asked by the 4 companies. Whether that was a statement of fact or whether this was a proposal reflecting the anticipation that all 4 companies would approach the firm is unclear. And that's why I want to be careful to say that it's not, I think, possible to deduce from the information that is in this material that this is something which Armour or indeed Alpha had signed up to. But it is perhaps more telling in a broader sense in terms of the pharmaceutical industry. And if we go to the next page, the objectives of this public relations proposal are set out to increase the awareness among haemophiliacs of the dangers of reducing infusion rates, i.e. there is more risk is involved of long-term complications from not conducting the infusions than in getting AIDS, and then to improve communications between haemophiliacs, their physicians, the haemophilia associations, and the supplying companies. And then it goes on to outline various suggested strategies, which I'm not, I think, going to necessarily go through. Well, perhaps if I just go to page 12, there are various what's described as communication tactics that are identified on this page, and then we go to the following page, which include the production of results in newsletters, producing booklets, having an advisory panel, and various other things. So, as I say, it may be of more general interest in terms of understanding at least what a public relations firm thought the pharmaceutical industry might want rather than assessing any action on the part of any individual pharmaceutical firm. But the other aspect of communication of risk I just wanted to briefly explore is the response within Armour to various media reports of risks associated with the use of their products. So if we look, for example, at ARMO 40483, we can see here a report in the New Scientist, February 1986, blood treatment may not kill AIDS virus. And this raised the concern that there were still seroconversions taking place with heat-treated products. And it's an article, again, I think we've looked at it before and we'll certainly, I think, be looking at it again. It refers to the allegations being made by Dr. Jones of seroconversion and a case in the Netherlands. And it expressly refers to the Armour product as well as a number of other products in the course of the article. There's a second article at ARMO 40472 at around the same time. This is a publication in The Guardian, so it's the left-hand side. Doesn't refer to Armour by name, but it talks about 4 men in the Netherlands and the US developing AIDS after taking heat-treated factor 8. You will note in here there is ascribed to Dr. Donald Aitchison, as we know, the chief medical officer at the time, what's said to be criticism of Dr. Jones for making this information public. In any event, there are two media publications in February of 1986, and we know that there came to be, in the course of 1986, this critical issue about the possibility of people receiving heat-treated factor 8 being infected with HIV. I just want to look at a few internal Armour documents which record discussions about how they might respond to such reports. We can pick it up at ARMO 40526. This is from Mr. Bishop to Dr. Harris, 25th of April 1986. So it's an internal communication. Again, we can perhaps ask Mr. Bishop about it in due course. It would appear Mr. Bishop is requesting action to be taken in response to the New Scientist article. And we can perhaps just look at the last sentence of Mr. Bishop's memo. On the basis of the foregoing, I would again recommend that we write to the New Scientist and also to Dr. Richard Lane to get an official statement from them, that's presumably BPL, that they do not consider their product any safer than ours in terms of inactivation of the HTLV3 virus. We can see then, if we go to ARMO 40548, this is a memo now, again, I think an internal memorandum from Mr. Bishop, dated the 4th of July 1986, and on the topic of seroconversion to HTLV3. And this is now referring to an article in the Lancet. We pick, so the Lancet, 31st of May, picking it up in the second paragraph. Sorry, it's two articles in the Lancet, June the 14th, 31st of May. Both these articles, besides attempting to clarify their own heat-treating procedure, that I think is a reference to Qatar, identify ours as being implicated in the cases quoted. The decision has been taken to respond to the Lancet within the next 2 to 3 weeks with a carefully prepared defence statement setting the facts straight. As soon as this document is prepared, copies will be forwarded to you together with a technical bulletin from Robert Christie, and then reference is made to enclosing certain documents and publications. And if we go over the page, there's what I understand to be the suggested information for inclusion within the defence statement. So the headed introduction, the suggested implication of Armour heat-treated factorators based on 2 cases, both of which received prior treatment with non-heat-treated products. I'm not going to go through the detail of those cases, sir. If we go to the bottom of the next page, having set out various matters in relation to what's said to be those 2 cases, the suggested summary is, in the penultimate paragraph, no seroconversion on any other clean virgin not otherwise at risk for AIDS has been reported, and live virus has never, underlined, been isolated from Armour's heat-treated factor 8. The above is subject to final ratification and update of personal communications. So it would appear to be being deliberated within Armour whether there should be a robust response by way of what was described as a defence statement to the articles that were being published in the Lancet. And if we go over to the next page, page 4, we can just see what I think is Mr. Bishop's PS. There was a meeting held in Newcastle by the Reference Centre AIDS Committee, at which the main topic of conversation was the double standards being applied by the industry with fully screened product and the NHS who are still supplying unscreened product. Unfortunately, there are rumours going about that Armour are supplying unscreened material, and this is probably originating from competitor sources, and you must please leave everybody in no doubt that all Armour material being sold is sourced from donor material which has been screened and tested for antibodies to HTLV3. So Mr. Bishop appearing to hold clear views as to the way in which the company should respond. As I say, we can no doubt ask him about that. If we then move on to CGRA 40527, this is again from Mr. Bishop, 16th of July of 1986. The heading is Proposed UK Defence Document, and we can see in brackets 2, Lancet and Technical Bulletin to Salesforce and Review to Swedish Health Authorities. Not entirely clear what that's meant, other than it seems to be a suggestion that there should be a response to the Lancet and then to some other publications. In the light of the US refusal to originate a defence document as discussed, I propose the following to form a basis for a UK-originated document. So pausing there, the inference that seems likely from this is the American company parent company has decided it's not going to produce a defence statement, but Mr. Bishop seems to be of the view that there should be a UK-based one. Objective, to nullify negative impact of the published seroconversion stories, to restore/confirm confidence in our heat treating process regarding HIV inactivation. 3, to demonstrate our faith in our own product. Thus, 4, to stop any further deterioration in sales at UK and Scandinavia. And then the suggested format for this UK-originated document is refer to the cutter letters in the Lancet and correct the misleading nature of the article. B, defend the 60 degrees centigrade for 30 hours referred to by the editor in the June 14th Lancet article by citing the Armour experience both in vitro and in vivo. C, summarise as per penultimate paragraph, and that's referring to his earlier document that we looked at, emphasise importance of comprehensive analysis of all data published and unpublished in the interest of the patient. I would emphasise that this document is essential for the maintenance of Factor 8 business in our markets. And then ARMO 40562. There's a further document from Mr. Bishop, dated a couple of days later, 18th of July 1986. It's described as a house message from Armour Pharmaceutical Company Limited. The subject is Factoration recall media response. We can see in the first paragraph he refers to copies of New Scientist and Guardian articles of the 17th of July on the above-mentioned subject, which is presumably the recall. I have it from an extremely reliable source that both articles were initiated by the actions of Peter Jones, and certainly in the case of the New Scientist, this took the form of him providing them with a copy of our recall/exchange letter together with his comments. This is obvious from the last paragraph of both articles, which forms the payoff, and is, in my opinion, an attempt to justify his previous outburst at the Newcastle AIDS conference in February, which you will remember caused so much consternation to doctors and patients alike. It may well be, and it is to be hoped, that the majority of doctors will view the articles in the light of this objective and the contents immediately discredited. This would appear to be the case from discussions both Mike Cross and myself have had to date with leading directors. Nevertheless, I will just elaborate on various points made in the articles, starting with the New Scientist. I'm not going to go through them, the detail of Mr. Bishop's comments. We can perhaps then explore that with Mr. Bishop in due course. If we go to the third paragraph, the third page, third paragraph. Mr. Bishop says this: "It is our feeling and that of our advisors, who include members of the UK Haemophilia Centre fraternity, that these articles be treated with the contempt they deserve, and therefore we propose to take no further action other than discussion by you with individual doctors who may express some concern which you are in a position to discuss on a sensible level. Unfortunately, the mention of Dr. Michael Riddell's statement that we're reviewing our heat treatment process now prevents us from preparing an official defence document/article to the Lancet, which would not be totally misconstrued by those wishing to cast dispersions on the Armour operation. We cannot, on the one hand, defend our existing treatment and then immediately introduce a new one, although the reasons for introducing the new process are primarily to attack the non-A, non-B problem. However, you are in possession of all the facts, which we obviously will continue to update you on, and we will rely on you to relay the correct factual information to all of your contacts." Now, as I've said repeatedly, we'll be looking at the heat-treated zero-conversion issue in November. I've drawn attention to these documents now, partly because they may help place in context some of the issues that we'll want to explore with Mr. Bishop in November, but also because it is perhaps useful to see what was being said internally within Armour to public discussions about risks from their products. So that, I think, is probably... one further document on the same theme, ARMO 40568.
568.
Yeah, 568, yes. This is Mr. Bishop, I think, to the same recipients of the communication we looked at a moment ago, 7th of August 1986. And again, it's in part on the issue of public discussions in relation to risk. He says in the first paragraph, "I know inquiries to you regarding a review of our heat treating procedure have been increasing lately, especially with the announcement in the press recently, Guardian/New Scientist, wherein Dr. Michael Riddell declared this intent from the States. In order to help you tackle these questions with some degree of credibility, the following should be the lines upon which your official response is made." And then there is set out a suggested line to take in terms of constant review of product range in order to upgrade and refine the products. If we look further down the page to the last two paragraphs, this is again still part of, I think, is the suggested line to take. We would emphasise again that this move does not imply any lack of confidence in our current procedure in terms of HIV elimination inactivation, but is designed to improve still further the safety factor in the product in terms of total viral inactivation without the need for the addition of stabilisers. And then he says this, naturally, we have a considerable quantity of existing material in inventory, and the last thing we need is for people to hold off ordering until the new product comes through. Over the page, we would emphasise, therefore, that it will be a phasing-in process and not an overnight change, and customers should understand this. If there are any queries resulting from this information, please let me know upon my return from holiday. But hopefully this statement will enable you to scotch any rumours as to our motives branded about by negative directors or competition. We know, of course, that exactly 2 months later, Armour withdrew Factorate and high-potency Factorate from the market, the communication of the 7th of October 1986. You may wish in due course to consider those discussions in light of that subsequent event. So that's the material on communication of risk. There are then just a handful of documents I wanted to show you, sir, in terms of some of Armour's interactions with other haemophilia centres and haemophilia centre directors. This is in terms of some of the studies that were undertaken as between Armour and haemophilia centres, in addition to the ones that we've already looked at, and some of the financial assistance or support that was from time to time made available by Armour to haemophilia centres. So there's just a few documents in that regard to show you, starting with HHFT 0001201_003. So here we have a communication between Armour and Dr. Jones, December 1980. And it refers to a protocol revised according to our discussion in Alton on the 1st of December. In addition to the modification to the protocol, we also discussed and agreed the following points. The 2 centres taking part will be Newcastle and Alton. Although each centre will recruit a minimum number of 6 cases, we would allow 10 sets of treatment of each product at the centre. The study was said to start in January 1981. There is then a cost estimate put forward, which gives a total, I'm not sure whether it's per centre or for the 2 centres, of £6,840. Over the page, you agree that these costs will be met from research funds initially, but we will then reimburse you on receipt of your invoice. We agreed that the Haemophil 2 would be obtained and provided by us. We therefore need to know, as a matter of urgency, the quantities which you and Dr. Arenston calculate to be necessary. So there is some funding proposed by Armour for the study at Newcastle and Alton. We've looked, I think, at the details of that study. There are so many, it's difficult to remember sometimes, when we looked at Trelaws. And indeed, I think we've seen it discussed in various minutes of the UK HCDO and the Hepatitis Working Party. So that's some degree of sponsorship by Armour of the study at Newcastle and Alton in 1980. And then if we move to 1981 and Oxford, OXUH 0001624_004. We can see a letter dated the 6th of August 1981 from Mr. Bishop to Dr. Ritzer at Oxford. It appears that from the first sentence that someone from Armour has made a recent visit to the unit. There's a discussion about a paper, and in the second paragraph, and Mr. Bishop says, as I've indicated in the past, Please let us help in any way we can regarding the preparation of this paper. That was a paper on inhibitor treatment. And then there's a discussion about possible future sponsorships. Mr. Bishop says we'll await the outcome of your application to the Medical Research Council and the Haemophilia Society. And then a cordial thanks in the last paragraph, and looking forward to seeing Dr. Ritzer again soon. So that's an example of an interaction with Oxford in 1981. I think we saw a little more of that when we looked at the Oxford Haemophilia Centre last year. If we then, by way of an example of interactions with the Royal Free Hospital, look at ARMO 40236. This is a letter dated the 15th of March 1983 to Mr. Bishop at Armour. It's from Dr. Kernoff, as we know, Director of the Haemophilia Reference Centre at the Royal Free. I ask you to note the date and then the heading. So the date is the 15th of March 1983. The heading is Proposal for Research Support into AIDS at the Royal Free Hospital. Further to our previous discussions, I now enclose a brief formal proposal requesting support for our AIDS-related project in haemophiliacs. As you'll see, the request is mainly for a one-year period of salary support for a senior technician, MLSO, in Professor Janis's department here, starting 1st of April 1983. The gross sum needed, which would, of course, be spread over the year, is a little over £12,000. I should, of course, be very pleased to supply you with any further information you may need. Any help Armour is able to give us would be greatly appreciated. And then we can see the research proposal over the page. The title of the project is Effects of Blood Products on the Immune System of Patients with Haemophilia. The principal investigators are Dr. Kernoff and Professor Janissy, who was head of the Immunology Department at the Royal Free. Background refers to recent reports of abnormalities suggestive of impaired immunological function in haemophiliacs, and you'll see reference in that first paragraph on the screen to patients having clinical evidence of altered immunity and a small number in the USA having developed AIDS. If we go to the I'll read the next paragraph. The causes of these abnormalities are unknown, but may include transmission of a previously unrecognized virus or other agent. The predictive value of simple tests of immunological function is also unknown. However, the possibility that infusion of essential therapeutic products may be complicated by very serious hazards is causing extreme concern amongst patients and those responsible for their care. It's been suggested that profound changes may have to be made in management practices, particularly as regard to the use of imported commercial concentrates. We regard the acquisition of further information about the immunological defects in haemophiliacs and their relationships with clinical disease and blood product exposure to be a matter of the highest priority. And then we can see under the heading Facilities and Expertise available at the Royal Free Hospital, set out why Dr. Kernoff said that the Royal Free was particularly well placed to research this. If we go to the next page, work proposed. Preliminary studies using the limited laboratory manpower available have shown that immunological abnormalities in haemophiliacs are not confined to those patients who've received commercial concentrates and have a close association with chronic liver disease. The objective of the proposed work, which will extend over a one-year period, is to reach more definitive conclusions about the relative morbidity associated with exposure to different blood products and the relationships between immunological abnormalities in the blood and those in tissue biopsy samples. Comparisons will be made with other groups of patients at increased risk of AIDS. And then there is set out the various analyses that it was proposed. The reason for requesting support from Armour is set out towards the bottom of the page. We can see what's being asked for is a year's bridging support, and it said our immediate problem is the lack of skilled technical manpower, hence the request is for funding for a trained technician. And we see the overall figure given on the next page, £12,396. If we go to ARMO 40238, we can see a response from Armour Pharmaceuticals, from Mr. Bishop to Dr. Kernoff, 7th of April 1983. He says he encloses a copy of a draft protocol compiled by Dr. Helen Townsend based on the recent proposal. It's been discussed by the Revlon Plasma Executive Committee, and then there is an invitation to Dr. Kernoff and Professor Janessi to come to Eastbourne and discuss the matter with Armour's medical director and other members of the medical and marketing departments. He's asked to prepare a presentation and so on. If we go towards the bottom of the page, there's then a suggestion of a spot of lunch, and there's an indication of the number of people that will be present. If we go over the page, we'll see it says that fourth line, I confirm we'll do everything possible to provide a definitive answer to the proposal as quickly as possible. I don't think I've got to hand any further correspondence, but this study was undertaken at the Royal Free. It's subsequently written up, I can't remember in which journal, but it's exhibited to the witness statement of Professor Christine Lee, and I'm pretty sure we've looked at it in earlier hearings. And it thanks, amongst others, Armour for their support. So the inference is, I think, that Armour provided the financial contribution. If we find anything to suggest that that's incorrect, we'll obviously bring that to your attention. So I've only a handful of further documents in relation to Armour, probably about 10 minutes worth. So question whether to do it now and then finish, or take a break and then start Bayer, or how you want to.
Which would you prefer to do?
Well, I think it might be sensible, if those present don't mind, if I just finish the documents in relation to Armour. There's just a few more documents on this theme of communications with and funding for research by Haemophilia Centre.
Well, we'll finish by half past 3 on that, I
Yes.
take it. Yes, let's go ahead.
So those were the communications between Mr. Bishop from Armour and Dr. Kernoff in March, April 1983, specifically in relation to AIDS-related research. We see around the same time communications between Armour and Dr. Preston at Sheffield, also for research into AIDS, and we can see that from ARMO 40239. This is again from Mr. Bishop. Dear Eric, further to the heading is important. Proposal for research support into AIDS at the Royal Hallamshire Hospital. There's an invitation then to Dr. Preston and Dr. Triger to come to Eastbourne to discuss the proposal, and an invitation that he do a presentation. Again, similar to the letter to Dr. Kernoff, they can have a spot of lunch before the return journey. In terms of the details of the proposal for which funding was being sought, we can see that at ARMO 40246. The summary of the protocol to be and the investigator's name is identified as Dr. Preston. The summary of the protocol is to compare various biochemical, immunological and cytological parameters associated with AIDS and impaired immunity states in haemophiliacs, age-matched controls in patients with histologically proven chronic liver disease, non-haemophiliacs. And then if we go down, we can see the funding that's sought is funding in the sum of £22,000. And then if we turn to ARMO 40268, we can see a letter from Dr. Preston to Mr. Bishop, 22nd of June 1983, in relation to this same research project into AIDS in haemophilia. You'll be pleased to hear we're now in a position to embark upon the project. We've also found a suitable MLSO to undertake the laboratory investigations. I'm therefore writing to ask if you'd formally accept my proposals for financing of the project. If you are in agreement, I'd be grateful if a cheque could be made payable to the Hemostasis research fund. And then we can see in the last paragraph reference is made to the project being already underway and that 1 or 2 of Dr. Triger's own liver disease patients are currently being investigated. And we then go to ARMO 40272. We can see from this, although it's a letter about something else, that funding was provided. So 19th of July 1983, Mr. Bishop wrote to Dr. Preston. He's clearly met up with him at the conference that we know took place in Stockholm in the middle of 1983. And then he refers to the funding. If we go to the bottom of the page, very bottom, it says CC. And Mr. Bishop said, I will leave it to you to sort out the payments, which I understand is against the budgeted of £7,000 for 83, 10,000 for 84, and 5,000 for 85. So I think it's reasonable to infer from that the funding was being made available, and there are subsequent communications which enclose copies of cheques to Dr. Preston for the purposes of the research. The last set of documents within this category relate to communications with Dr. Hill at Birmingham, ARMO 40370. This is a letter 27th of March 1985 to Dr. Hill from Mr. Christie at Armour. You will note from the enclosed copy letter that I paid our first 1985 donation to your research fund to the Finance Department of the Central Birmingham Health Authority. We continue to be very interested in the progress of this project and, of course, its extension into HDLV3 screening of children who've been treated with non-treated and latterly heat-treated factor VIII. And you'll recall, of course, sir, that Birmingham Children's Hospital was a hospital where the Armour factor VIII product was in very substantial use indeed. And then there's reference to an anticipated, or a hope to visit to discuss the current status of your research and the recent hepatitis B problem. And there's reference to a need to notify the DHSS of the findings. Sorry, there was one other communication with Dr. Preston at Sheffield I meant to refer to. It's ARMO 40369. It's again from Mr. or Dr. Christie, Director of Clinical Sciences at Armour, to Dr. Preston. It's March of 1985, so it's 2 years further on from the material we looked at before. We can see reference to a cheque for £2,500 to cover our first quarter 1985 support for research in your unit. It may well be that's an ongoing payment in relation to the same research. But the point I wanted to draw attention to is the rest of the letter. With respect to this research work and the publication of your experience with the heat-treated factor VIII in 2 patients, I hope to come and see you when next in Sheffield. Incidentally, do you have any information on the pre- and post-dosing status of these 2 patients with respect to HDLV3 antibody? A negative picture before and after treatment in both cases would be valuable information for us if it could be demonstrated. So a request there for specific information from Dr. Preston about the HDLV3 status of 2 patients. So that's a flavour of some of interactions with haemophilia centre directors and some of the funding that was made available by Armour to haemophilia centre directors. The other body, of course, with whom Armour's relationship in the UK is particularly important is the Department for Health and Social Security. We've looked at a number of the interactions in relation to the licensing application process. We'll look again in November at interactions in 2 specific points in time. Anything more we find out about the 1983, middle of 1983, interactions between Armour and the department. when consideration was being given within the department to the way to respond to the fear of the dumping of pre-March plasma from the US, and then secondly, the important interactions with the department that took place in the course of 1986, in particular with Dr. Rotblatt of the department, in relation to the issue of seroconversion from HTLV3. But I'm not going to attempt to deal with any of those issues in any more detail now. We'll deal with that when we come back in November. So that finishes the picture in terms of Armour for the purposes of this week.
In which case we'll start up looking at Bear at 5 to 4.
Certainly, sir.
5 to 4.